My name is Kaylee Dyring and I am doing the newborn pass-off. So I would bring baby to here to the warmer and I'd put an ID band on baby. Check APGAR scores. APGARs were 7 at 1 minute and 9 at 5 minutes, which is really good. And then what I would do is just make sure to look at the appearance, color, tone, movement, how well the baby is moving. Everything looks normal so far. And then I would weigh baby. Baby is 7 pounds, 10 ounces. And then I would also now measure the length of baby, get vital signs, which we will here in a second. Baby is 21 inches long, and then I would get a head circumference on baby's head. Perfect. 14. And then I would get a chest right at the nipple line. 13. Then right at the focus. 13 and a half. So everything looks normal there. And then I would write it all down. After getting those measurements, I would make sure to suction out mouth. I would also, right when they came out of the womb, I would make sure to scrub baby down, make sure everything's off the baby. And then I would give them vitamin K shots for any clotting, and then I would also put erythromycin into the eyes just for infection. So here's your erythromycin in the eyes, vitamin K. Make sure you use an alcohol wipe. Put it right here into the leg. Here's your vitamin K. Just gonna put that all back. I would make sure to get a temperature. Perfect, and the temperature was 98.1, which is perfect. After that, I would make sure to check on baby's back and spine, which looks great. I would check the head, fontanelle, make sure there's might be a little bit molding, but other than that, there's no capitis. Nothing that sticks out. So that looks all good. Then I would just listen to baby's heart rate, lungs, make sure they are within the range, which it looks like it was. Heart rate was 138, which is good. Respirations was 48, which is perfect. It has to be within 30 to 60 breaths per minute. And color of the baby was a little pink with bruising on the left cheek from the forceps, which is just fine. We just have to make sure we write all that down. Baby has attempted to breastfeed, but latch needs support, which then we will go in there and educate mom, and we could also get someone to come help educate as well on breastfeeding. Baby has passed stool and it was meconium, which is good, and nothing else that really needs to be done. We would look at the genitalia, we would look at the clavicles, I think I said that, just to make sure nothing's abnormal there, broken. We would check the reflexes, making sure when you scare baby that their hands go out. The palmar, perfect. And then I'd also have gloves on. Wash hands, make sure that you're clean before you touch baby, because that's actually really important when they first come and when you do an assessment. I would also check for rooting, which is putting my finger in the mouth, making sure that baby is sucking. I would also do Babinski, which is touching the feet, and that looks normal. Grasping the hands, everything looks good on the reflexes. Then I would just get baby all ready to give to mom, and make sure I educate mom on everything that I've done. I'd also look at like the umbilical cord, tell her not to put any alcohol on, to let it just dry on its own. I did check for the genitalia, which it's a boy. I have to look at that, make sure everything looks normal. Ear, nose, and throat looks normal. They're pretty even, both sides. Nose looks good, mouth, throat, they all look good. Baby's doing really good. Baby is having a hard time latching, so we will make sure to notify and teach mom, as well as helping baby with that. And then I would wrap baby up. In a blanket. And it would be better wrapped up if it was a blanket, but this works for now. And then I would go take it to mom and then do skin to skin contact, which is really good. Mom, baby Lopez did great. He, honestly, there's nothing really wrong with him. He's looking good. He's doing really good. You did talk about latching was a little bit more difficult for baby, and we will assist you in any way we can when baby is ready to feed.